Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I want to talk to you a little bit about health benefits and why it is so important to protect what you have. We all know that over the years, depending upon when you were hired by the city, most of us we know from our older generations, we planned for our futures for pension and healthcare. And those are some of the things that were important to us was taking care of our future, right? In prior to 2001, you were vested for healthcare if you worked for the city for 5 years. In 2001, the law then changed that you were vested for healthcare after 10 years of service. And then the only union in the city, to my knowledge, then later in negotiations, um, negotiated that vesting for healthcare would be 15 years of city service, and that would be the UFT. I am not aware of any other union having done that. Um, and that was done under Michael Mulgrew. Now, think about term limits. Those who are serving the city of New York would not be eligible for city health benefits if they do not have 10 years of service. Um, so in that situation, you'd have to stick around a little bit, whether it was for city council, working in some sort of a city job in order to qualify for benefits. Why was that a concern? Um, because if you didn't have health care, what would you do? You would have to move out of the city job that you had to try to get benefits from a private sector employer. Well, this started to get polarized in about 1999. You all heard us talk about Mayor Lindsey and in 1965 when Medicare came about, um, and was being put into effect in 1966. By 1967, when Mayor Lindsey tried to implement it for his workforce as retirees and active employees, he learned that he can give Medicare to city employees who were 65 and over and still employed by a personnel order, but he could not give it to retirees who were already retired. Why? Because they were no longer employed by the city, and since they were no longer represented by unions because they were retired, the only way to change their health care was by passing a law to do so. And so Mayor Lindsey went to the city council and said, with the advent of Medicare coming online, I would like to give Medicare to retirees. It would save the city's money because then the city would only have to really pay for the city supplement. He was also finally at this point moving to pay for health care for employees and retirees. And with that, he started going from like 25% to 50% to 75% to paying for the full cost of health coverage up to the HIP HMO. Why the HIP HMO? Because the HIP HMO is a plan that was born by the city for the city workforce, right? So whatever the rate was of the HIP HMO would be the benchmark. And any other plans, and there was 3 plans at the time, GHI, the HIP plan, and I think Metropolitan was the third one. And and is whatever the plan was at was the HIP rate was what the city had to pay up to for any of those plans. Um, so when 12-126 was drafted by Mario Marola and Edmund Farrell, and Mario Marola, who spearheaded that bill, also was an attorney and later became the district attorney of the Bronx. And these two council members drafted 12-1, what would become 12-126. That law still reads the same way, that the city will pay the full cost of health coverage up to the HIP HMO for every employee, retiree, and their dependent. Okay. So Mayor Lindsey did not work for the city very long. After his term was over, he left, he was an attorney, and he went back into private practice. In doing so, however, later in life, he thought that his law firm would provide him with pension or health care, and that didn't end up happening. Um, as he got older, he became more infirm and was suffering from Parkinson's disease and had a lot of health issues. He had a stroke, um, cardiac issues, and this started to bankrupt him and his wife. Um, that said, he didn't have health care. And so at his stage of life, he ended up not having health benefits. And in 1999, it became known to Mayor Giuliani at the time, who thought it was absolutely horrible that the man who gave health care to the city workforce, who was mayor of the city of New York and was ill, was dying without insurance. And in order to honor his service to the city and have him live in dignity, Mayor Giuliani basically gave him like 2 jobs to do in which would qualify him for city health care. And by that time, I think it was like 99, um, after about that time, he left the city and he and his wife moved to Hilton Head, and a year later he died. Um, in 99, as he was leaving city service, Mayor Giuliani went to the city council, to Peter Vallone and Mary Pinkett, to pass legislation that any former mayor would have access to health benefits. This law was passed, I believe, in February of 2000, just as he was settling in Delaware. I mean, Hilton Head, and he had health care for the last year of his life because this law passed. Um, it became known as 12-126.3, which allows that anyone who served as mayor would be entitled to city health benefits, even if they didn't fall or qualify under the vesting rules, simply because they were mayor to the city of New York. So I want you to think about that, because here was a man who almost died without health insurance after serving the city as the mayor and gave health benefits, covering the full cost of coverage for every employee, retiree, and their dependent, that he himself didn't have it. So I know we did a video on this. I'm going to link it in the description down below. I know we talked about this once before, and I showed you an article in the New York Times, I believe, or San Francisco Chronicle or something about this story. But I do want to let you know that now, today, because of this law that was passed in early winter of 2000, that any New York City mayor now has health care and can live their life in dignity. The same health benefits that we would have as employees, retirees, and their dependents, the same plans. So if if Mayor Adams is paying attention to this video, this healthcare is your healthcare, and you shouldn't want to privatize your healthcare. You shouldn't want to put your entire workforce, including yourself, into a managed care plan at the hands of people who repeatedly try to diminish healthcare benefits and pass costs on to employees and retirees. I totally understand being fiscally responsible, but Medicare eligible retirees are your least expensive cost to the city. Therefore, privatizing their healthcare plans, putting them in managed inferior care, especially with the Aetna plan, with any Medicare Advantage plan. But Aetna has been overcharging the government, has been given a request by the Department of Justice to pay back $25.5 million in overcharges, has also been in the Office of Inspector General Health and Human Services report for wrongly delaying and denying care. narrowed networks, prior authorizations. This is not what you want people to experience, especially your most vulnerable population. So heed the story of Mayor Lindsey. There's a reason why a sitting mayor recognized what was happening to a past mayor and made sure that he had the dignity of healthcare that he championed in 1967. Think about that. Because in 2024, the New York City Retirees is bringing a bill back to protect traditional Medicare. And that this is a city, a democratic city, that should not be privatizing health benefits, diminishing them for their most vulnerable population, for those who served, to ensure that they have health coverage when they need it most. Have a good night.